Hello, everyone. How you doing? Good evening. From Nigeria, it's exactly 1 minute gone past 5 o'clock. So it's let's say technically 5 p.m. here in Nigeria, Lagos, Nigeria. Good evening, and thank you so much for being with us this fantastic evening. We genuinely appreciate you for choosing to spend your evening with us. So quickly, the world all over celebrated World Mental Health Day on Tuesday, 10th of October year 2023, which was just last week. And it was an opportunity for a lot of us, a lot of people, both people in the medical field and in the non medical field as well. Everyone who cared about mental health, it was an opportunity for everyone to band and unite behind the theme for this year's World Mental Health Day, which was Mental Health is a Universal Right. It was also an opportunity for you and I to learn more about mental health in general. Someone once asked me a long time ago, and the person said that I think it was a listener on radio, and it was World Mental Health Day actually, and the person called in and said, "Why do we need another day for mental health? We have so many days. We have Children's Day, we have World Tuberculosis Day, cancer, and what have you, and that why do we need World Mental Health Day?" And I remember responding to him that even if we had no need for it, the COVID-19 pandemic sure gave us tons of reasons, to now need it. So I'd like to say a special thank you to every medical person, especially medical people, actually, every medical practitioner championing this cause, raising awareness, driving actions, and improving our knowledge on mental health, both physically, using traditional media or social media. We genuinely, appreciate you all. You're deeply appreciated. Thank you. Ladies and gentlemen, today is Saturday, 14th October, year 2023. And on behalf of the Talk Mental and Emotional Health Foundation, I say welcome to the maiden edition of Mental Health Conference. And this year's theme is Mental Health for All. My name is Adeyemi Kelanley, and I'll be your anchor person this evening. So thank you so much for being here this evening. Today promises to be very educative and informing as well. So please try as much as possible. Do stay with us. And we specially curated, if I can say that, our speakers for you. They are incredible people, so I really can't wait to hear you. Listen to me. I really can't wait for you to hear them and listen to them and learn from them this evening. We also planned. We have a question and answer segment, for you as well after each speaker. So you also get to ask her those questions that you've had in your head for quite some time about mental health or about their respective teachings, if I can say that this evening. So please stick around for that one. But quickly, before we go further, I'd like us to listen to something from our founder. That's the Talk Mental and Emotional Health Foundation, the founder of this beautiful foundation. Her name is Dr. Adeola Adeyemi. I've known her for quite some time, and maybe I'm a little bit biased, but she's such a phenomenal person. She's a fantastic human being. I met her in church a long time ago. And I remember that she was just very nice to me, very kind to me, very warm and all that. And our kids, our first kids, are around the same, I think basically the same age though. She has a 6 year old, I have a 6 year old as well. And I think the second child is a little bit older than mine as well. But Diola, she's incredible. So I'd like us to have, but before we hear from her, let me let you in if probably you've never met her before or you've never read about her before. Quickly, her name is Dr. Adeola Adeyemi. She's a consultant psychiatrist, a psychotherapist. She's experienced in cognitive behavioral therapy and mindfulness training. She's also a mental fitness coach. Having been in the medical field for over 22 years, Dr. Adiola is driven by a vision to help build a society where mental health is normalized and emotional well being is prioritized. This passion led her to start her company called Talk Mental Health in 2018, an organization that aims to help individuals, especially women, live healthier and more fulfilling lives through innovative mental health interventions. With over 2 decades of experience, in the medical field and about 9 years in the mental health specialty, Dr. Adiola helps the clients achieve holistic well being to enable them to become better people and live happier, healthier, and more productive lives through her consultation, therapy, and coaching services. She's a self care advocate promoting preventive mental health through self care and author of You Deserve a Bliss. That's a beautiful book that Dr. Adeola actually wrote. It's a self care guide to everyday fulfillment. She's also a seasoned speaker. She's facilitating on site and online training for both international and local corporate and religious organizations. She has appeared on major national media outlets such as Spice TV, Pop Central, TVC News, This Day newspapers, and the Tribune on mental health and wellness related issues. Dr. Adeola is a board certified mental health expert, fellow of the West College of Physicians, that's FWACP. She is also a member of the Association of Psychiatrists in Nigeria, APN, and Royal College of Psychiatrists, London. She received further training from Johns Hopkins University and the University of Washington. She's also well experienced actually, in leadership and management in health and gender based violence. She currently lives in the United Kingdom where she works in the National Health Service, also known as NHS. Ladies and gentlemen, join me in welcoming our founder. That's the founder of Talk Mental and Emotional Health Foundation, Dr. DrAdeolaAdeyemi.
Good evening, everyone. Thank you so much, Adenike, for that beautiful introduction. And of course, I'm really, you and I have come a long way. And I'm grateful that we're able to keep the relationship despite the distance. I welcome you all to Talk Mental Health Conference. This is the first of its kind, and I really am grateful to God that we're able to pull this through. I would say that this is an initiative of a foundation called Talk Mental and Emotional Health Foundation. So, well, the theme for this year is mental health for all. It's the first of its kind, and the reason why we chose that as our theme is because of the World Mental Health Day's theme, which was the mental health is universal human right. And we believe that this theme embodies our commitment as a mental health foundation to making mental health support accessible to everyone without exception. We believe that everyone deserves to be mentally healthy. And because of that, it's important that they stay healthy because it helps their functionality. So you and I deserve to be mentally healthy. You and I deserve to be able to access help when we need it. Unfortunately, there's a lot of barrier to this. And one of the things that we do at Talk Mental Health is to create awareness and to push the fact that we need to be intentional about our mental health. I've worked in the mental health field for about 10 years now. I remember I started training in 2014, and I've come across patients that were very, really ill. And I saw the number of years it took, months to years it took for them to recover. Another thing is that sometimes when they recover, because they don't have insight into the illness, and also because they of the stigma and the discrimination in our society against people with mental illness, they're likely to come down with another relapse. Relapse meaning that there's a recurrence of the symptoms that they used to have before. So I just realized that that's more like a cycle. The same patient, after we've discharged for a number of months, after being treated for a number of months, they come back to the hospital after discharge, a few months after they've been discharged. So I just thought to, found Talk Mental Health in 2018 because I believe that people need to be proactive about their mental health. I thought that I can't just stay within the four walls of the hospital and treat mental illness. I needed to come into the public space and create awareness where I tell people, I teach people, and I continue to create awareness about mental health, about how to be proactive about our mental health. This is a short story about how Talk Mental Health came to be. And over the past 5 years, we've been able to evolve gradually, slowly and steadily. I'm grateful to God that we we are moving forward. Yes, this is the first of its kind. This conference is the first of its kind. And I'm grateful that you all are here to have an amazing experience. I am very passionate about what I do, perhaps because I've had experience myself. I mean, I've had mental health breakdown myself. And this is what I'm sharing with you all, for you to know that no one is immune to mental illness. We all are liable. We all are at risk, if I must say, because according to the World Health Organization, 1 in 4 persons will come down with mental illness in their lifetime. So just count the number of people that are on live watching right now. So I think about 32 of us watching live right now. And I know more people are going to join. You just count the number of people that are prone to coming down with mental illness. So that's why we're here today. We are here today for you to take proactive measures about your mental health, for you to not take it lightly. Not, the Bible even says, guard your heart with all diligence, because out of it flows the issues of life. So you can't just play or joke around. You have to be intentional about doing things that will protect your mental space. No one is immune to mental illness, and mental illness is no respecter of persons. If you expose yourself to too much stress, and if you keep pushing yourself too hard, you are likely to break down mentally. So you need to take good care of yourself. I love to tell people that you need to learn to set boundaries. You need to learn to incorporate self-care activities into your everyday life, because we know that when we break down with mental illness, we need to get treated, right? And we know how expensive that could be. But we are unable to control what is going on right now in Nigeria, in Africa, and all over the world in terms of getting access to mental health care. But what you and I can control is how to protect our own mental space. So we need to work on our minds intentionally every day. By the way, I have a question for us. What comes to your mind when you hear the word mental health? What comes to your mind when you hear the word mental health? I need you to put it in the chat box. What comes to your mind when you hear the word mental health? What comes to your mind when you hear the word mental health? What comes to your mind when you hear the word mental health? I want to know if you can ask them, what comes to your mind when you hear the word mental health? Yeah. Okay. I'm waiting. What comes to your mind when you hear the word mental health? So the reason why I'm asking this question is because I want us to know that mental health has nothing to do with mental illness. You know, we always mix that up. We believe that when you're talking about mental health, it has nothing to do with me, because I am, God forbid, I'm not mentally ill. So Dr. Adeola is not talking to me today. She must be talking to someone else, maybe someone wearing tattered clothes and walking on the street. But I need you to know that every one of us have got mental health, right? Every one of us, we have mental health, and we need to protect it. Yes, I can see Patrick, mental health for me, I think well-being, someone has said wellness, mindfulness. Say Franklin is saying insanity, and we're talking about mental health and not mental illness. Franklin, thank you very much for being being truthful, being honest. One state of being. Another person has said what else? The mind. Yeah. So I just need us to understand that because it is mental health, people tend to think it is mental illness. And this has got to do with me. So we just shut our mind to whatever it is that we're saying about mental health. We just shut our minds. But it is important for us to know that mental health is not always about mental illnesses. By mental illnesses, I mean depression, anxiety, psychosis, and all. We all have got mental health, just as we've got physical health. So the way you have your brain, and your brain is all about your mental health, is the way you've got your heart. And your heart is about your physical health, which is maybe cardiological problems or something like that. we need to learn to take good care of our mental health. The absence of mental illness is not an evidence of mental stability. Let me say that again. The absence of mental illness is not an evidence of mental stability. You might not have diagnosis of depression, you might not have diagnosis of anxiety disorder, you might not have diagnosis of schizophrenia, but you can still be mentally unhealthy. You know why I say it so? According to the World Health Organization, mental health is a state of well-being in which an individual is able to understand his potential, cope with normal stress, work fruitfully and productively, and contribute meaningfully to a society. So we need to ask ourselves this question, those four criteria rather, how often do you fulfill it? How often do you fulfill those four criteria? Understand your potential. Are you sure you understand your potential? Are you sure you're following your purpose? Are you sure you're passionate about what you're doing, or you're just living life and trying to hustle and make money? Number two, are you sure you are able to cope with normal stresses of life in adaptive way? Because many a times we cope maladaptively. We cope by doing things that are not healthy. But are you coping with stress normally? Number three, are you working fruitfully and productively? Number four, are you contributing meaningfully to your society? You need to ask yourself these questions, because when you're able to fulfill all these four criteria, then you're considered mentally healthy according to the World Health Organization. And these four things that I have mentioned, they don't look like they have got depressive symptoms in them. They don't look like they've got schizophrenia in them. So we need to understand that we can't just neglect anything that has to do with mental health because we don't have a diagnosis of depression or anxiety. All right, so I just wanted to know that that's a point that I need us to understand. And if we won't take anything from today's conference, let's remember that we need to be intentional about our mental health. And to everyone that is struggling, let's say you're here, you're watching this live, or you're watching it much later on the YouTube channel, and you perhaps have had a mental health breakdown, and you're wondering, maybe Dr. Adeola is not talking to me. I am talking to you. I am you, you are me, because I've been there myself. And I want you to know that you have to learn to celebrate your progress. Don't put too much pressure on yourself. Don't be trying to look at your recovery as, I want to get to this particular place. That's when I can appreciate how much progress I've made. So you have to learn to celebrate yourself. You have to learn to, appreciate how much progress, the little progress you make towards your recovery. Mental health disorders are usually chronic in nature, and that's why we are here today, to protect our minds, one, and also to prevent mental illness. If you have mental illness already, you want to prevent a relapse, right? So you need to understand that mental illnesses are chronic in nature, and waiting for you to recover fully, before you appreciate yourself, is going to make you feel less of yourself. It's going to affect your self-esteem, and it's going to dampen your mood and affect your recovery, basically. So according to Noam Shamsa, mental health is not a destination, but a process. So it is about how you drive, not where you're going. So you need to understand that mental health is not a destination. You're not looking at your mental health that I have to get here before I feel good about myself. It is about how you drive your journey, not not where you're going, rather. So that will be all for now. And thank you very much. I want you to ensure that you wait to the end, because we have two amazing speakers coming to shed more light into the theme mental health for all, and also to explain to us the barriers that usually would prevent people from taking care of their mental health, or also accessing help when they need it. Thank you, thank you, thank you. God bless you.
Thank you very much, Dr. Adeola-Adeyemi. She's actually the founder of a Talk Mental and Emotional Health Foundation. She put all this together with an incredible team. But honestly, Dr. Adeola, well done. Well done. I hope you give yourself credit, but you're a phenomenal woman. You really are. You're an inspiration. Well done. Well
you.
done.
Thank you.
So at Talk Mental and Emotional Health Foundation, there's so many things, that we have lined up for you at the foundation. But quickly, while I was reading her biography earlier, I talked about a book that she actually wrote, a book on self-care, because she's a self-care mama. She's always, championing self-care, especially if you follow her on social media. The book is actually titled You Deserve Bliss. You can actually find that on Amazon, and it's on sale as well. It goes for about $14, but if you're in Nigeria, I think it's about 7,000 naira. So do not hesitate to get this book. And you can also buy for a loved one, actually. Recommend it to your loved ones as well. And talking about loved ones, please do not forget to share the link to this conference. Share on all your social media platforms. Share on Instagram, your status on WhatsApp. Share on Twitter, everywhere. Please share the link and do not hesitate to like the link as well. So again, keep sharing, keep sharing, keep sharing the link to this beautiful conference. Thank you so much. So quickly, I'd like to quickly talk about our first speaker for this evening. Her name is Dr. Mojubola Abiri. She's a consultant psychiatrist. She's a psychiatrist. She's a lecturer as well, a managerial psychologist, EAPA professional. She's a professional speaker, a trainer, a mental health content creator, and the CEO of Ready Med Consulting Services. She's the co-author of two books titled Mental Health in the Workplace and the Handbook of Forensic Mental Health in Africa. She recently pioneered Nigeria's first one of a kind mental health advocacy digital network titled Mental Health with Dr. G on YouTube. She's a fellow of the West Africa College of Physicians, WACP, a member of Nigerian Medical Association, NMA, the Employee Assistance Professional Association, EAPA, and the American Psychiatric Association, APA. She has received trainings from the King's College in London, the University of Washington, and the prestigious Harvard University, Boston, USA. She also has a trainings in psychological therapy interventions of cognitive behavioral therapy, CBT, dialectical behavioral therapy, DBT, and acceptance and commitment therapy, ACT. Passionate about research in trauma, child and adolescent forensic, women's mental health, and occupational mental health, Mojibola is a mental health advocate who is driven by the holistic view to health, and as such is a regular voice on various print and electronic media, where she utilizes illustrations and indigenous language to reach her audience with content that drives mental health awareness, education, and empowerment. She currently runs a cartoon column, I'm serious, a cartoon column in the Guardian Life Nigeria titled On the Couch with Dr. G. She also uses her knowledge in psychiatry and psychology to influence and maximize effectiveness and productivity in the workplace via the Employee Assistance Program, that's EAP. She's a director of women's mental health at the ACEDO Foundation and is a faculty member at the Lagos Mind. She works with the THR as a sexual and gender-based violence advocate. She's a member of the Global Advisory Council of Joy Inc. and volunteered with the Lagos State COVID-19 Psychosocial Response Team, where she was in charge of emotional wellness and development of training materials for the healthcare workers. Ladies and gentlemen, I told you earlier while I was, signing on that our speakers, the two speakers that we have for you, we specially research these people for you. And trust me, Dr. Mojibola Abiri, she's more than qualified to talk to us this beautiful evening. Join me in welcoming to the stage this evening Dr. Mojibola Abiri. Good evening.
Hello. Good evening.
Good evening.
Thank you very much for that very warm introduction and for pronouncing my name so right.
You're
I really
welcome.
have, I really have people say it right, but I mean it's okay. It's indeed a pleasure to be speaking to each and everyone on the call today. Well, I live and work in Lagos, Nigeria, and so the conversation of mental health is global. It's not just local here in Nigeria. And I must commend Dr. Adeola and the Talk Mental Health team for the amazing work that they have done so far. This evening, yes, I am first speaker, first of two very distinguished, if I do say so myself, speakers. And we'll be talking, to the topic of today. We'll be speaking about the topic of today. I will be speaking about mental health for all. I believe that the organizers have my slides. And so if you could please help share my slides, that would be, extremely helpful so that the conversation can be seamless from this end. Okay, so I guess that I will do this from my end. I've been able to sort it out somehow. Could you please confirm that you can see my slides? Hello?
Yes, we can see your slide. I can see your slide.
Okay, all right. Thank you. So is this me sharing or you guys sharing so that I don't close the one on this end?
It's been shared.
Okay, thank you very much. Right. So good evening, distinguished ladies and gentlemen. My name is 𝐓𝐡𝐚𝐧𝐤 Abiri, and I've been very well introduced. This evening, I'll be talking to us on the topic mental health for all. Why is it important? Why is it topical? Why is it apt for this time and age? And again, I must commend the Talk Mental Health Niger for this very well-timed conference. Let's move on to the next slide as we talk about the issue that this is us. And so usually this is a comical piece that I share when I get to speak, and I talk about how it is that this is all of us. This is you and I trying to manage our mental health, trying to protect our mental health, and just trying to cope with all the pressures or the stressors, what we call the 𝐒𝐥𝐤 Pro Max, and the 𝐒𝐥𝐤 Banza that we're all going through, not just in Nigeria, but world over. And so I think that it would be nice to, engage the participants on the call this evening. If I asked you how it is that you've been protecting your mental health, what are some of the things that you would say that you've been doing? So let's put in the chat box, what are some things that you have done either in recent times or in the past to protect your mental health? Let's see our options. Let's see them start to drop. Fastest fingers first. How have we been catering to our mental health? How do we cater from time to time to our mental health? Okay, so Yomi Dada says, remain positive. Thank you very much. Overdose says therapy. Ojo Temitope says, I avoid arguments. That is peace. No this and no peace. Global Harvest UK says meditation and rest. Charles Itua says self-care. Thank you very much. Very, very brilliant ideas. Very, very brilliant methods of how it is that we've been, managing our health and well-being. Thank you very much. Healthy for Life Step says walking, vacationing. I particularly love that one. And praying. Margaret Olubaro says doing exercise, listening to music, generally doing the things I love. Obey. I make a decision every day to be happy. Moyosora Shonuga says, I love to take some time off work and extra activities. We all do need it. Patrick G says he joins the Hallelujah Challenge. Tell me about what it is that praise and worship can be a natural antidepressant. Kamalafe Victoria says, listen to music, positive affirmations, and pray. Thank you all so much for your contributions. Thank you, thank you, thank you. And I'm sure that each and every one of us can look at what someone else has written and learn as well. All right, then, let us move on to the next slide and talk about how it is that for this mental health conference, what exactly is it that we can do to ensure mental health for all? And so on my next slide, I talk about real people, real issues. I usually like to share stories to, particularly let people understand that when we talk about mental health issues, we're not just talking about something that happened to somebody 5,000 miles away. We're talking about something that affects each and every one of us, and the fact that anyone, regardless of age, gender, socioeconomic status, religion, race, can be affected by these issues. Let's move on to the next slide as I talk about the disclaimer. And I'd like to give a disclaimer. Usually when I share stories, I like to give a disclaimer so that people understand that the people who I will speak about in the next couple of case studies have had their ages and their roles modified. And so if we find any semblance to anyone who is on this call, please just be reminded that it is purely coincidental. This conversation is largely for knowledge's sake. However, if you do feel distressed by anything that we may share or that we may show to you today, there's a reason why the doctors are in the building. All right, let's move on to the first case study on the next slide as we talk about what is the good in mental health. And here I share a story about T.O., a 36-year-old nursing officer who walked into the emergency room of the Yaba Psychiatric Hospital 9 years ago. On that visit, she made complaints about mood disturbances, sleep problems, and poor concentration. She was given new medication. During the consultation, she hinted on ending her life and she refused admission. In the early hours of the next morning, she made an attempt on her own life. 9 years later, however, she is still alive. She is well, and she's an active advocate for mental health, as she and her family utilize available mental health services in time. Let's move on to the next slide and see what the bad in mental health is. I met this patient, MD, while at work 5 years ago. I turned around to ask the nurse a question, and before I turned back, the patient had gotten up and left. This repeated itself 3 times over, the first time, the second time, and the third time. What's going on with him, matron? I asked. Oh, you don't know his story, she responded. He was locked in a room for 15 years by his relatives when he fell mentally ill. He used to eat, drink, bath, and defecate in the same room. He has lost all social skills. Now let's see how it is that mental health issues can actually really get ugly. And so on our next slide, we see the story of S.A., who fell ill 2 years ago. Our relatives insisted that it was a spiritual attack, that it was wickedness in high places, and that she must be brought to the village. Her husband obliged because they started to imply that he wanted to use her for money rituals and as such cast a spell on her, which led to her mental illness. They refused all medical intervention, saying that traditional healing was the best. 4 years after her stay with Baba, S.A. is pregnant with her third child for Baba. Relatives still insist that it is part of the healing process. You cannot throw her away. She is still your wife. When Baba is done with the cleansing process, she will come back to you, they echoed. How much more ugly can this get? But these are real issues, real people. This is real life. And while they have been formed into stories, these are some of the stories which form a tip of the iceberg of issues affecting people with mental illness. Now let us move on and talk about the mental health of the future. And the mental health of the future is one. It is 2023. Mental health is free for all. There is no stigma, no discrimination. Everyone can access mental health. People can talk freely about their mental health issues. There's no discrimination, no shame, no stigma. Nobody is beating them anymore. But that, like I said, is the mental health of the future. It is 2023, but it is rather unfortunate that in this age and time, there's still a lot of negative culture that mental health is shrouded around. And so let us move to the next slide and start to talk about what exactly is the culture towards mental health issues. What is our culture? How do we deal with it? Culture, of course, usually refers to the way of life of a group of people. And so over the years, how have we heard people speak about mental health, talk about mental health, communicate about mental health, share about mental health, or attend to people who have mental health issues? And so let us move on to the next slide as we start to talk about the culture. And some of the culture that I have spoken about is number one, the culture of silence. Over the years, people have often said that silence is golden. And so many of us, including some people who may be on this call, have often thought that, well, if I just put my head like the proverbial ostrich in sand, it's silence. I don't see anything. I don't see anything. Nothing. Say no evil, hear no evil, taste no evil, touch no evil, perhaps. But after a while, silence is not golden. When people are faced with prejudice, when people are faced with discrimination, when people are faced with hardship, and when people are faced with injustice and bias, silence is no longer golden. And so we should actually do away with silence. The second culture that I identified as we go on to the next slide is the culture that has to do with ignorance. How much do we know? How much do we actually share? Here we see the picture of 4 people who have been tied to walls, tied to sticks, tied to tree branches with heavy metals around their hands, their legs, tied to tire rims that are so heavy that they cannot move. And people like you and I, who just because they have mental health issues, beaten, stripped naked, starved, and of course, many left for dead because they had been put through a lot of inhumane situations. Let's move on and see what the other culture is. And here I talk about the culture of shame, stigma, and discrimination. Very often, the culture around mental health has been one of shame. We make the people who have mental issues feel ashamed. We stigmatize them in our language, in our behavior, in our perception, and in our attitudes. We discriminate against them and do not let them have equal access to resources, to opportunities that the rest of us have. Interestingly, they are people just like you and I. And so let's look at the last culture that I decided to look at. And that is indeed the culture of nonchalance. If it's not in my house, if it's not affecting my wife, my children, my husband, my mother, my father, my brothers, then it is not my business. And so we've also, learned over time that, well, if it doesn't affect you, why are you bothered about it? A few years ago, a senior colleague had gone to meet a philanthropist in Nigeria, and she tried to make a case for children with autism. And she said, "Sir, please come to our aid. Come and build an autism center for us." And the man looked at her and he said, "Madam, do you have a child with autism?" She said, "No." "Do you have relatives with autism?" She said, "No." "Do you have anybody with autism?" She said, "No." He said, "So why are you bothered? It's not in your house. It's not near you." But then again, what people do not realize is that beyond the individual who has the mental health challenge, all of us suffer. And so let us move on to the next slide and talk about what our reality is. And so in spite of all of this culture, we must understand what our reality is. Our reality, like Dr. Adeola said when she, started the conversation today, is that the WHO has said that 1 in 4 persons in the general population and 1 in 5 at the workplace will experience a mental health disorder at some point in their lives. In spite of the fact that a lot of people suffer, we must come to the understanding that between 76% and 85% of people with mental disorders receive no treatment at all. I must reiterate that mental health issues are no respecter of persons, regardless of age, gender, socioeconomic status, race, or religion. The burden of mental disorders continue to grow, with significant impacts on health and major social, human rights, and economic consequences in all countries of the world. In spite of progress, people with mental health conditions continue to experience severe human rights violation, stigma, and discrimination. We must also know that mental health issues are a major contributor to morbidity, more illnesses, either physical or mental, and mortality. Beyond the individual living with the mental illness, all of us suffer we suffer a lot. We suffer significantly, and we may not know it. Let's move on as we continue to see what our reality is. Our reality shows us that anxiety is the commonest mental health disorder. Depression closely follows, and depression is one of the leading causes of disability. A lot of people in this day and age are actually depressed and do not even know, especially when we talk about what is known as the functional depression, the max depression, or the smiling depression. So the high functioning depression, max depression, and the smiling depression. Suicide is the 4th leading cause of death amongst individuals aged 15 to 29-year-old. And so even people younger than that and older than that can still go on to end their lives. Substance abuse disorders are on the rise. And so we see people mixing all sorts of chemicals, like Olamide probably said in his song, becoming science students. Domestic violence and intimate partner violence are also on the rise, and they are significant life-threatening issues. We must not forget stress, social isolation, and loneliness, as despite the fact that we have so many more ways to communicate with each other. We have Facebook, we have Instagram, we have WhatsApp, we have Snapchat, we have everything. A lot of people are lonely. A lot of people are isolated, and a lot of people are under stress, and these are contributors to mental illnesses. Persons who live with mental health disorders, they die prematurely, and they die at least 2 decades earlier than other people because of preventable physical conditions. I remember many years ago, a lady had come into my consulting room with her children. And when it was time to go, she said, "Doctor, help me look at my breasts." And the children said, "Mommy, what are you saying? We brought you here for your brain, not your breast." But she said, "Doctor, look at my brain." And the children wanted to dismiss her. And I said, "No, I will listen to my patient." By the time I decided to examine that woman who had suffered a mental illness for so many years, I found that she had breast cancer. And it was something that had gone on for so long. But because no one paid attention to her physical health, all of the attention was on the mental health. This woman continued to suffer. We must know today and take away from this conversation that mental illnesses have known causes. They are not spiritual or punishment from the gods. Treatment options exist for mental health disorders, and early diagnosis and prompt intervention remain the mainstay of management of mental illnesses. Let us go on. And I must announce at this time, if I had a siren, I would let it ring out loud. From local to global, we have an emergency. See what it is that we're talking about. See the pictures that we're looking at. It is 2023. And the honest wish, the honest desire, and the honest prayer is that we would have moved away from here. We would have moved away from all these tales that we're still telling. All these tales of, mentally ill people being beaten, being starved, being sexually abused, being physically abused. But unfortunately, that is our current reality. And so I say to you, we have an emergency. Until we start to make mental health conversations center stage, we have an emergency, especially because it affects each and every one of us. Why are we having this conversation? Let us move on to the next slide. As we talk about the fact that the 10th of October every year, and of course, even on Tuesday, 2023, was the World Mental Health Day. The World Mental Health Day is a day that is set aside to look at and give awareness and education about mental health issues. Mental health issues are common, like we have found out today. The theme for this year, of course, is that mental health as a universal human right. The theme reminds us that mental health is not a privilege. It is a basic right that everyone, regardless of where it is that they come from, regardless of who it is that they are, it is something that every one of us, regardless of our role or background, should have access to. It shouldn't be prioritized as being, the food of just a few. It is the food of everyone. And so everyone should have access to mental health. Let's move on and talk about how it is. What exactly is mental health? And so usually we hear mental health. In fact, usually when people say mental, people are like, no, don't bring it beside me. But mental clearly refers to the brain, the organ that is known as the brain, also known as the mind. And health, according to the WHO, is not just the absence of disease or infirmity, but a complete state of physical, mental, and social well-being. And so when we say that an individual is mentally healthy, it means that this individual is successfully able to perform the functions of the mind, the functions of thought, of emotion, of perception, and of behavior. And when an individual is mentally healthy, this individual is able to do four things. 1, engage in productive activities, have fulfilling and thriving relationships with others, be able to adapt to change because change is a part of our lives. And last but not the least, this individual is able to cope with adversity and with the normal stresses of life. Let's go on and talk about how it is that mental health is actually a continuum. And so usually people feel like, once I have mental health, I have it all. I don't need anything else. I have mental health. But the truth is that as humans, we all face challenges day in, day out that may actually become a threat to our mental health and well-being. And so every day, each of us need to take active and deliberate steps to ensure that we remain in good mental health and well-being. because we're usually swinging between that pendulum that is good mental health and well-being and poor mental health and well-being. However, our awareness, how educated we are, and how it is that we commit to coping well and learning how it is that we can cope with healthy methods is what will ensure that we either continue to be in good mental health and well-being, or that we struggle with poor mental health and well-being. We must be aware that mental health is a continuum, and that every day we must take decisive decisions that are clear, conscious, and deliberate to ensure that we remain in health at all times. As I continue, of course, I must talk about the conversation of the deterrence to seeking help. Let's move on to the next slide as we look at the deterrence to seeking help. And so people are ill, people are sick, people are mentally ill. 76 and 85%, between 76 to 85% of them have mental health issues, but they're not seeking help. Why not? And the answers are here. Our perception, how we perceive them. We're like, see that guy, he don't start again. Nakolo mental. Our attitudes, our language, our behavior towards mental health issues prevents people from seeking help. Our stereotypes and the negative portrayal of mental issues continues to fuel the discrimination. Oh, you have mental health issues. Does it mean that you've gone loony? Are you crazy? Are you balloony? Again, our stereotypes and the negative portrayal. The ignorance does not help. It doesn't help because over the years, people have not improved their knowledge about mental health issues, largely because of all the cultures that I spoke about earlier. Stigma and discrimination comes from everyone, from society, from employers, from the media, from our own friends and family, and sometimes even patients stigmatize and discriminate against themselves. Like in the words of Jay-Z, the rapper, Jay-Z says, men lie, women lie, but the numbers don't lie. And so the indicators are poor. The numbers don't lie. Our numbers of patients are increasing, especially when you look at all of the stressors in the environment, the political instability, the financial insecurity, the negative news, the COVID-19 pandemic, all other illnesses, pressure from work. You know how it is that we say that the pressure is getting worse. There's pressure from work. There's the pressure from JAPA. There's the pressure from SAPA. There's the pressure from what is called the JAPADA. There's so much going on and people are struggling. And so when people struggle, number of cases will increase. There's a decreasing number of professionals because, well, many of our professionals are, looking for where the grass is greener, but the water bill, of course, is higher. There's poor funding for mental health. And unfortunately, because people present late, they don't present early. They would rather go to spiritual houses, traditional healers rather. And so the recovery rates are poor and patients struggle as well. As I start to round up, I want us to look at this story that I titled Mental Health for All. And this story just, goes to show me that there's hope. There's hope if we present early, and there's hope if we do what it is that we're supposed to do on time. And so this young couple came into my room to see me to the clinic. They were referred by the neurologist on account of seizures and psychotic experiences. So psychosis is when an individual hears voices of people that are not there, sees strange things, hears strange things, perceives things strangely, or believes that, somebody somewhere is going to harm them, despite not having any evidence. He has been hearing voices of unseen persons and seeing strange things. Our mothers, his mother and her mother, had advised that they should bring him to the village for deliverance. They said that it was a spiritual problem. And I said to them, I must commend your mother's willingness to help you. But for now, we will start him on medication. And we will have weekly clinic sessions over the next 2 months. Tell your mothers that we will all be praying, that they should be praying, all will be well. Over the months, this young man has improved significantly as all the unusual symptoms have reduced. He has gone back to work and he even got a promotion while at work. His wife also got pregnant. At the last clinic session, they told me they had good news for me. The husband had been offered a job abroad and he was offered citizenship for the entire family. There can be mental health for all if we take the right decisions at the right time. If we seek professional care early. As I start to round up, I want to talk to us about how it is that we must open up and seek help. Next slide, please. We must open up and seek help. We must learn what mental illness is. What is mental illness? An illness that can affect the functions of the mind and cause disease, distress, disability, death, and an important loss of freedom. When should we seek help? Seek help early. Once you see anything that you do not understand that is strange to you, please seek help. Early intervention and prompt treatment remain the mainstay of management. Why should you seek help? Because your mental health matters. And because many things will suffer if you suffer. Where should you seek help? Seek help from professionals, certified and licensed professionals who you are sure know their onions. Which disorders should you seek help for? Seek disorders for every disorder that you seek help rather for every disorder that you do not understand. Someone in the chat room said Sorosoke. Yes, this is a Sorosoke generation. Sorosoke for your mental health. And how should you seek help? Ask the right questions from the right professionals. Never be in a hurry. Never take hasty decisions about your mental health. As I wrap up, I want us to understand that we should aspire to be in health, because health is a complete state. Health ensures that we enjoy our quality of life, that we are happy, that we are refreshed, that we live our best lives, that we enjoy ourselves, but that people around us also enjoy us, that our work is productive, and that at the end of the day, we are able to contribute our quota to the environment that we live in. As I close, I want to, share this quote by Professor Vikram Patel that says to us that mental health is everyone's business. Just because I'm a professional does not leave that responsibility with me alone. It doesn't leave it with Dr. Adeola alone as well. It doesn't leave it with the nurses, the psychologists, the occupational physicians alone. No, it is your business. It is my business. And so please do not leave it to us alone. And we must always remember at all times that there is indeed no health without mental health. I have a video up. I don't know if the video is available to be played, but if it can be played, I would appreciate that very much. Thank you very much, distinguished ladies and gentlemen. Mental health. What is the culture around it? 1 in 4 persons at some point in their lives will have a mental illness. Considering the fact that mental illnesses are no respecter of persons and can affect anyone regardless of age, gender, religion, race, or socioeconomic status, what is our culture towards it? What is our culture towards people receiving mental health treatment? Shame, stigma, discrimination, ignorance, silence. Shh. Could you be one of those normalizing this negative narrative which affects the health-seeking behavior of persons with mental illnesses? Unfortunately, this behavior ultimately leads to increased distress, suffering, disease, loss of freedom, and even death. To change the culture, we must change the conversation. We need to change the mindset such that people understand that mental illnesses are just like any other illness. We must speak up and confront negative stereotypes such as shame and discrimination. We must ensure that people who have mental health issues can easily access the care they very much need. Speak up for mental health. Do it for the culture. Remember, there is no health without mental health. Thank you all, participants, distinguished ladies and gentlemen, for your time and attention. Thank you.
Thank you, everyone. Thank you, Dr. Bonju. We can't hear our MC, so I think there must be some connectivity issues there. But I don't know if we've got questions for Dr. Bonju Abiri. This is time for question and answer whilst we get that resolved. Let me go to the comments. Okay, so people are really grateful. They're saying, thank you very much. Okay, so there's a question there. How do I deal with panic attack? Any other question? I think another person is saying, how do I stop getting panic attacks? So Dr. Abiri, I don't know if you want to answer whilst we wait for other people to send in their questions.
All right. Well, thank you very much for the questions. It's interesting that the two questions are on panic attacks. In fact, once I saw it, I'm thinking, Adeola, you should do something on panic attacks.
I should.
We both should, anyways. So, panic attacks are a type of anxiety attacks. And it's a good thing that at least you're able to identify that it's an attack, not a disorder just yet. And so it means that it comes in, bursts every now and then, where all of a sudden you feel like you're in a panic mode and you feel like everything around you that you are, losing control. And so how can you manage yourself when you have a panic attack? I think that one of the most important things that you can do is try to identify what your trigger is. Is it a certain place? Is it a situation? Is it a person? Or is it a process that makes you feel panicky? So first of all, identify what makes you feel panicky. Identify what your response is when you start to feel panicky. But one of the most important things that you can do for yourself after, identifying what the trigger is and what your response is that you can do breathing exercises. And so, breathe in. So we talk about mindfulness breathing exercises where you pay attention to the environment, you become still, become one with yourself, close your eyes, keep yourself from distractions, noise, breathe in deeply through your nose, hold it, and then let it out through your mouth. So we call it the 4-7-8 breathing technique. There are actually quite a number of breathing techniques. Some call it the box breathing technique, but I would teach you the 4-7-8 breathing technique. And so through your nostrils, breathe in over 4 seconds, hold it for 7 seconds, and then let it out through your mouth with a whoosh sound. And so try to do this as many times as possible. What you're trying to do basically. And so I see some questions with dealing with, the unknown, anxiety. Anxiety requires that you do something that is called grounding. Ground yourself. Remind yourself of where it is that you are. And so, ground yourself. So another thing that you can also do to ground yourself is there's something that we call dropping the anchor. And so, like we all know, an anchor is something that, the ship uses when it gets to somewhere where it's trying to stabilize. And so what that pretty much tells us is that, there are a lot of storms around. But when there are storms around us and we want to still ourselves, we drop the anchor. We drop the anchor using the ACE. A-C-E. The ACE. A, acknowledge what it is that you're going through. Tell yourself, this is what I'm going through. This is what is going on with me. I'm struggling right now. I'm having a panic attack. Don't fight it. Don't fight your reality. Otherwise, it will cause more distress. The second thing you should do is to come back into your body. And so try to center yourself. Where am I? What am I doing? What can I feel? Am I sitting down? Am I standing up? What can I see around me? The third thing that you want to do is that you want to engage your senses. And so engage your 5 senses. Again, look out around you and the room for 5 things you can see, 4 things you can hear, 3 things that you can touch, 2 things that you can smell, and 1 thing that you can taste. By the time you do all of this and you continue to do it, you continue to improve the exercise, it's likely to help you center and ground yourself and allow the panic, attack to go away. However, if you find that, you're beginning to have quite a lot of recurrent panic attacks, please C, a therapist or a professional? Thank you. Adeola, can you hear me?
Yes, I can.
Right. So I'm done with that question. I can see a couple of other questions as well.
So there's a question on the screen now that says, can I share my mental state or condition to my employers and not get stigmatized?
Well, I mean, so this is a very personal and very interesting question. And I wish that I could say yes and say yes with my full chest and say yes 100%. But unfortunately, this is one of the realities that we're still dealing with. How it is that many workplaces, many individuals, many employers, and it was one of the things that I talked about how it is that stigma and discrimination comes from everyone. You may not be able to state effectively what their response will be. And so here's what I will tell you. If your state of health, your mental health, is not affecting your productivity, is not affecting your relationships at the workplace, it may not be necessary to share that news. However, if you find that it is, something that as, made you take time off work, you may want to share with someone who you find as respectable, who you believe that you can trust, and who you know that if that information gets into their hands, they will not share it with the wrong person. But if it is not entirely necessary, don't bother sharing your mental health, information with anyone. That's what I would say. Thank you.
So there's another question here. I don't know if you can say, Dr. Bonju. My question is, it's one thing to be mentally educated and another thing to get care and treatment for it. How do we get treatment and care for our mental health? And I think someone is also asking for your contact. So perhaps if you could just share how they can reach you.
All right. So I'll take the question on being mentally educated and getting care. And, I like this question because it pretty much speaks to what it is that we call the burden of knowledge. A lot of us, we know so much, but we don't do so much. And so we keep listening every day, we keep learning, but are we actually utilizing the information that we're getting? And so it's a matter of how it is that you must use your own medicine. Research will show you that individuals who pay attention to both their physical and mental health are likely to live longer, more satisfying, and more happy lives. And so if that information is out there and you know that there's a lot of 𝐒𝐥𝐤 going on around in the country, I mean, the best thing that you can do for yourself is use the information that you have gotten and use it to your advantage. And so how should you get care? And so I'll look at you and I'll say, if you have a car, they put a certain mileage on the car. After a while, you take your car for regular checks. Sometimes if you hear a creaky noise in the car, you say, what's going on there? You take your car for checks. But we rarely do that to our minds. And it is not until we break down, because what pretty much happens every time is that our body keeps taking the score. Our body keeps saying, yeah, bring it on, I'll take it, bring it on. And then you also keep feeling like, I can take it, because you show up every day. However, asking yourself a very simple question: how am I? What's going on with me? Why am I behaving cranky? Why does it look like my mood is low? That's self-assessment. And it's a form of self-awareness and self-regulation. But after a while, you may actually need to speak to a professional, either because you are going through a difficult time in your life, either because you are transitioning, or sometimes all that you want to do is actually just get a check. Let me see someone else who I can talk to take me through these motions. Usually, we should be able to see a therapist when we go through difficult and tough moments, such as losing a loved one after being served breakfast, losing a position, failing an exam, feeling depressed, feeling unloved, feeling unworthy. It's not until, people can't, take care of themselves or have locked themselves in rooms for days or months that we now realize that they need help. Anyone can speak to a therapist. It is not until we break down fully that we should see a therapist. Thank you.
Okay, I think we'll just take one more question. I'm trying to see which of the questions should I put up. Okay, let me show this. Oh, sorry, someone just put.
Yeah.
Okay.
So I'm happy that you chose this question. especially because, and so the question says, why is it that mental health issues are often not associated with men, despite the fact that men are frequently affected by mental health challenges? Well, so this is a myth. The reality is that men have mental health disorders as well. In fact, some mental health disorders are more common in men as compared with women. And so, for instance, substance use disorders, the use of alcohol and other, substances, illicit substances of abuse are common in men. Suicide, successful suicides are commoner in men. I mean, look at the videos that have come out on social media this past few days in Lagos, Falomo Bridge. Even though, those were suicidal attempts, it was men more than women. And so I think that what has happened over time is that there's been a lot more focus on women's mental health at the detriment of men's mental health. It's also largely because men look for socially acceptable ways to cope. And so a man is more likely to, want to hang out with the boys, buy one for the road, drink alcohol, and pretty much, use substances of abuse to medicate their symptoms. So it's not like men don't have mental health issues. In fact, men break down, men cry. A lot of men are struggling, especially due to, financial issues, marital issues. A lot of men are struggling. And so men struggle, but men rarely open up. And so that's why today, again, we're encouraging that don't take that narrative where they say men don't cry. Don't take that narrative where they say man up, guy, what's in they do you? My dear, if you need to talk to a therapist, please, by all means, reach out for help and support. Thank you.
I think we have a lot of questions, but because of our time, we may not be able to answer all of the questions. But I think this particular question is quite important, and if you're able to help us answer it.
Right. So please, doctor, you mentioned that anxiety is the number one cause of mental health disorders, not mental health disorders. How do we draw a line between anxiety as a feeling and anxiety as a disorder? Thank you very much. You've asked a very, very intelligent question. Now, anxiety, like stress, is a normal response to a threat. And so, for instance, I remember during the COVID-19 pandemic, I planned to travel to Italy. Italy was one of the highest heat places with COVID-19. When I did my test and my test came out, I was like, it's negative. But when I kept thinking that I was going to the epicenter of COVID, of course, I was anxious. But I was also reassured because, one, I had a negative test from Nigeria and I had been fully vaccinated at the same time. Now, anxiety is entirely normal when we have a threatening situation that threatens our safety, sanity, stability, and security. However, anxiety can become a disorder when, for instance, the threat has been removed, but the response that the individual has continues. So, the response, which might be cognitive, inability to think straight, inability to pay attention, mood, fluctuations, physical symptoms like palpitations, going to the toilet over and again, diarrhea. That's when anxiety disorders start to come in. And we usually say in, our line of work that a disorder happens when the symptoms start to increase in intensity, in frequency, and cause distress to the individual's functioning, and the individual's relationships as well. Thank you.
Thank you so much, Dr. Abiri. Perhaps you could share with us how we can reach you. Many people want to contact. Yeah.
Okay, so please follow me on my social media platforms. On Instagram, I'm Dr. DrAdeolaAdeyemi. I will reply. I always reply my messages. You can follow me on my YouTube page. It's Mental Health TV with Dr. G. And you can also send me an email. My email address is bonjubola.abiri@gmail.com. It may take a while for me to get to it, but I will get to your message. Thank you very much.
Thank you so much. We really appreciate you. Thank you for giving us those amazing tips on how to protect our mental health and for sharing the culture, the normal, natural culture that we are aware of that has perhaps affected us in terms of seeking help, and more like there are barriers to getting help when we are in need or when we are mentally unhealthy. All right, I think I would let the anchor come up now to continue. Thank you, Dr. Abiri. Okay. So we can't still hear you. We can't still hear you. I don't know what the... Do you want to go out and come back in? Maybe that would help. No, we can't hear you. No. The second speaker is in now. I might have to introduce him. He's my dad. I fondly call him my dad. We fondly call him Rev. So Rev is the... I'm coming. Let me just get his. So Rev is the founder and the global lead pastor of Global Harvest Church, with branches around Nigeria and several countries abroad. For over 35 years, Rev has served God passionately and variously as a pastor and evangelist and apostolic oversight of Global Harvest Church and associated ministries, touching lives of many people across the globe. He is also an author and hosts social media broadcasts, crusades, and conferences. Through the teaching and preaching of God's word and the demonstrations of the Holy Spirit and power, he has led many into supernatural experiences of salvation, healing, and impartation of spiritual gifts. He is married to Jumoke, we call her Mama, with whom he presides over their growing ministry, and their union is blessed with 4 adult children. So permit me to introduce to you my dad. Thank God we both bear Adeyemi. So yes, he is my dad. Daddy, welcome. I'm so happy that you're here. I am grateful that you were able to come and for honoring me, for honoring us. God bless you, Daddy. The reason why Dad is here today is for us to understand that being spiritual does not stop you from seeking help for your mental health. Dad is here he's a spiritual man. He's our father in the Lord, and he's here to speak to us about mental health. So I'll just leave the stage to him to fire on.
Thank you, Dr. Adeola, my beloved daughter. I have always been so excited and enamored by the attention that you have given to the subject of mental health. Of course, somebody will say you're a psychiatrist, you should, but it's one thing for people to just go into a profession and another one for them to go into it with a sense of calling and the passion with which I've seen you pursue the subject of people's mental health makes me know that it is definitely a calling for you. God has called you into this space, and I'm very grateful for all that you are doing to bless people's lives. I'm particularly quite interested in this subject because I am somebody who has gone through my own fair share of mental health problems. I grew up, like I would tell some people, to be a champion warrior, so to speak, somebody who very easily worries about every little thing and will get quite anxious, about little things. But after I gave my life to the Lord Jesus Christ, which was in a time of depression for me, I had failed school cert, elementary, no, not elementary education, now what in the Western world would be called high school education at the age of 14. And that's possible in Nigeria because I started primary school at the age of 4. The school where I started from had only 2 classrooms. That was what a primitive village it was. So when a set passes out of primary 6, like the educational system would allow in those days, a new set comes into primary 1. Meanwhile, the guys who were in primary 1 before are probably around primary 3 or 4 at the time. So if I would wait, my dad discovered I would be like 7 years old before I could get into primary 1. So he was like, I should just go into school at 4. And for some reason, he got in a hurry before I could finish primary 6 because I was brilliant enough. he somehow got me registered through the help of an uncle who was a teacher to sit for the school certificate examination that will qualify me to go into high school at the age of 9, and I passed, and so that's how I entered into secondary school, or what you would call high school in the Western world, at the age of 9, and graduated after 5 years at the age of 14 by the educational system of the time. It was the 6-5, not 6-3-3, as they have it in Nigeria right now. It's 6-3-3-4. It was 6-5-2-3 or 6-5-4 in those days. So I, however, failed the exams at the time. I was done. I didn't do well enough for me to make a progress to university. And that, coupled with poverty that came in as a result of the advent of military, the military returned to power in Nigeria after ceding power to the civilians 4 years before. And so when they did, it affected our dad, who was a politician at the time and did not have contacts in the military to get jobs. So so it was a time of terrible poverty, and without education, you just can't see your way through. You can't see the future. You can't see how you will amount to anything. So it made the future look gloomy and made life look unbearable and not worth living for me. I entertained thoughts of suicide, even though I lacked the courage to be able to carry it out. And so that would be my first major major experience of mental health problems, and I've encountered a couple more in life since then, and that's why I now got born again. And when I got born again, that really helped matters. Giving my life to Christ, embracing the Lord Jesus Christ, did something to me, and what it did to me was to bring me a sense of hope, because after I gave my life to Christ came the revelation of the future. In John chapter 16, verse 13, the Lord Jesus Christ talked about how when the Holy Spirit comes, he will guide us into all truth. He will not speak of himself, but whatever he hears from the Father, he will speak to us, and that he will show us things to come. That knowledge of things to come began to come to my heart. I began to receive strong impressions in my spirit about the future God had for me. This came with a strong desire to preach the gospel and a sense of reality and assurance that I will become a preacher of the gospel. I will travel around the world. Even as I'm speaking right now, you can see that I'm kitted myself a little bit more, because I am in Scotland, where I flew to this morning to preach, and it's colder in Scotland than England at this particular time. But as a teenage boy, I saw myself in, preaching the gospel in many countries of the world, living a life that was not only impactful, but also faring a whole lot better than what my present conditioning was at the time. In other words, the kind of welfare and prosperity that I was wishing for my life at that particular time, if I had the education I desired at that time, I saw would become a reality in the future. So that gave me hope. That gave me hope. That sense of hope was what pulled me out of the pit of depression. Now, despite the fact that I now got born again, did not mean that I will not face mental health challenges again, or face depression again. I was pulled out of this depression in the year 1985. In 1990, I became a pastor. When I became a pastor, God blessed the church I was pastoring. It grew with rapidity. Within a year, there were more than 1,000 worshipers in church within a year. And that filled me with so much joy. I was in a happy place again in my life. The happiness and joy I had as a child before I lost it due to academic problems, was restored to me. And I was really excited and was in a very happy place. Then the second year came, and then the church grew even further and ballooned into the church of 2,000 people. Then the third year of that church came, and there was crisis with some leaders in the church. And this crisis threatened the church with division, threatened it. Now, I had come to derive a lot of self-esteem from the success of my ministry. And because my esteem was tied to the success that I was experiencing at the time, anything that threatened the success of that ministry threatened my sense of self-worth and esteem. So I found myself anxious. I became extremely anxious. And I was so anxious, it got so bad that I couldn't sleep well at night anymore. At the very height of it, 10 milligrams of Valium, which is a sleeping capsule, 10 milligrams of Morgadon. I don't know if it still exists, but it was another sleeping tab. Were not able to put me to anything more than 2 hours of sleep in 24 hours. So I was watching my life ebbing away. Now, I was born again. My spirit was intact, but my soul was the problem. So I came to discover that just as you can be a born-again Christian, your spirit is recreated in the image of God in oneness with the Lord Jesus Christ, that if you don't cater to your soul, just like if you don't cater to your body can fall ill, your body can have infection, your body can have disease. It is in the same way that your soul can also have problems. And I found myself in this terrible anxiety disorder at the time. I couldn't sleep at night. And initially, the thought was maybe it was some form of fever and so on. So over 2 weeks, at different times, 4 doctors treated me. And at the end of 2 weeks, I was still very terribly ill and was not getting better. Then lab test results revealed there was no malaria fever, there was no typhoid fever, there was no blood infection. There wasn't any of the things that they could imagine. I saw the doctors and they were all puzzled. Until one doctor spoke up and said, if this thing is not a physical problem, then it may be a mental problem. Can we get him to see a psychiatrist? And that was when I was taken to a psychiatrist. I was a 24-year-old young man. I was pastoring almost 3,000 people at this time. And the weight of the work and the crisis was going to crush me. So I went to see a psychiatrist, and the psychiatrist was like, what do you do? Oh, I told him I'm a pastor, pastor this growing church, and so on and so forth. Then he asked me, he said, any problem at work? Oh, yeah, there's this crisis. There's some funny church members. They are making trouble. They are being rebellious and disobedient. They are threatening to leave the church, this and that and that and that. He said, are you worried about it? I said, oh, yes, it's quite worrisome. I've been very concerned about it. It's been difficult to sleep thinking about the trouble. Then the psychiatrist told me, he said, well, Reverend, this is what I'm going to tell you. You are dying because you are not sleeping. If you continue this way, he said, you are going to get into a very terrible problem, mentally and physically. He said, because right now you can't even get more than 2 hours of sleep with very serious medication, like Valium, like Morgadon. He said, so you know what? He said, the answer is in your hand. You are going to have to take your mind off what you are going through. You have to discipline this mind and take it off whatever you are worried about and stop worrying about it. And you are going to put it in the hand of God who sent you. There was a psychiatrist talking to me now. He said, all I'm going to do is that I'm going to give you 𝐒𝐥𝐡𝐢𝐧𝐠. That was what he gave me to just calm your nerves. You will only use it for a few days, not more than 3 days. And I want you to go do everything you can to stop worrying about what you are worried about. So I left this office, number one, knowing I must do something about this. And I want people to know that mental problems are not things that you neglect, or your mental health is not something that you ought to neglect. It's something you should do something about. The beautiful thing is there is something you can do about it. That is just the beautiful thing. Biblically, from the word of God, there are things you can do about it. Secondly, you've had people speak today. There are things you can do about it, medically speaking also. You can go see a psychiatrist, you can go see a therapist, and they can help you out when you find yourself in situations that you cannot handle by yourself. It is very, very important. Don't see your mental health as, oh, if I have a mental problem, it means I am insane or something. No, not everything is insanity. And for the people who even go into extremes of psychosis and such things, we just have to have compassion on them. There are times when some of these problems are due to circumstances, and there are times when they are due to genetic factors. There are times when they are due to environmental factors. But hey, just the way God has given us doctors who treat physical problems, people have also gone to school and learned how to deal with mental problems. I'm not the kind of pastor who will say, hey, when you are sick physically, oh, you have nothing to do with drugs and so on. I believe in divine healing. I have a healing ministry. God uses me to bring healing to people with physical problems at times. There are times when even people with mental problems get miraculously healed, but there are times when it is not so. And so I encourage people to get help. Even I don't shy away from getting medical help when I need it. I don't try to pretend and give the impression I never see doctors. I don't even joke with my annual medical checkup. I make sure that I keep tab on what's going on in my body every single year. And I try possibly doing a simple blood work half a year just to know what's going on, so that if I need to make corrections in my lifestyle, I can make those particular corrections. And so it's very important. Don't joke with seeing a psychiatrist when you need one. Don't joke with seeing a therapist when you need one, or a mental wellness coach when you need to see one. Make sure that you take good care of your health. But as a pastor, I'm going to share a few things with you from the spiritual standpoint that is very helpful. And what I'm sharing with you does not replace what the doctors can do in your life when you need a psychiatrist, or what a mental wellness coach can do in your life when you need one. However, these are the following things that have helped me on my journey, and they can help you too. Number one is a sense of hope. One of the reasons why we find ourselves in the pit of depression is when we find ourselves in a sense of hopelessness. But when you find yourself in a sense of hopelessness, that is when you need to remind yourself that you have God on your side. That is when you remind yourself of Hebrews 13 verses 5 to 6, where it says, he has said, I will never leave you nor forsake you, so that I may boldly say, the Lord is my helper. I will not fear what man shall do unto me. In Psalm 46 verse 1, it says, God is a refuge and a fortress, a very present help in trouble. No matter the situation and circumstance in which you are, remind yourself that God is present. Very, very important that you remind yourself, I am not alone in life. God is with me. Say that to yourself again and again. Remind yourself, I am not alone. God is with me. Number two, remind yourself that for as long as there is life, there is hope. As long as there is breath in your nostrils, there is hope. There is, for as long as you are alive, things can turn around for the better. Job said there is hope of a tree if it is cut down. That is in Job chapter 14, verse 7. It said there is hope of a tree that if it is cut down at the scent of water, it will sprout again. In other words, cut down a tree. For as long as it still has a roots and a shoot in the ground, when moisture comes, even though it's been cut down, probably it was as tall as 100 feet before, and now it's leveled to the ground. Once there is moisture again, it will sprout and begin to grow again. So there can be a loss of job, a loss of relationship, a loss of reputation, a loss of money, a loss of resources, loss of opportunity. But for as long as there is life, you can sprout again. There is never a life with a loss where there is no remnant or something left over that God can use for a miracle. In other words, there may be no food for 5,000 men, aside the women and the children, to eat in the wilderness. But for as long as there is 5 loaves and 2 fish somewhere, God can use it to feed 5,000 men apart from the women and the children. So say to yourself again and again, for as long as there's life, there is hope. As long as there is life, there is hope. The third thing about this hope thing is for you to remind yourself that there is always a way. There was somebody, I've forgotten who this author was, who said, there is always a way, find it. There is always a way, find it. And from the biblical story of Moses and the children of Israel, we learned when they stood before the Red Sea that God made a way where there seemed to be no way. Oh yes, the word of God tells us in 1 Corinthians 10 verse 13, there is no temptation taking you but such as is common to man. But God is faithful, who will not allow you to be tempted above that which you are able to bear, but he will with every temptation make a way of escape. God is a way maker. He makes ways of escape where there seems to be no way. So for these 3 things, if you do these 3 things, remind yourself of these 3 things, it will revive hope in you. When it revives hope in you, then it helps with the anxiety problem. It helps with taking care of your sense of despair, and so that you can have a sense of hope once again. The number 2 thing that is very important concerning your mental health is for you to learn to pray. Like somebody said, prayer empties the heart. It was 𝐒𝐤𝐴 that I heard make that statement. Prayer empties the heart of its cares. It's been discovered that when people ascribe to a higher power, it often helps them in the midst of their anxieties. But I can tell you as a pastor that this is not just a matter apart from the psychology of it. Truly, there is a God in heaven. And a hymn writer wrote a hymn that says, what a friend we have in Jesus. All our griefs are sins to bear. All because we do not carry. I mean, it says, oh, what a peace we often forfeit. Oh, what needless pain we bear. All because we do not carry everything to God in prayer. I remember my wife being in the labor room. And by the way, today is a beautiful day for me because I became a grandfather for the 2nd time today. That's another beautiful baby girl who was born to my daughter. But I remember very well that almost 30 years ago, my wife had been in labor for more than 24 hours, and she was not able to have a baby by herself. And I was told to go get everything that is needed for cesarean section at UCH Ibadan, Nigeria. And I went and I made all the preparations. Now, my heart was overwhelmed. My wife was in a condition in which her life was on the line between life and death. I mean, when you see a woman who is in labor, you realize she's in between life and death. So my wife was in that condition. But what did I do? I got myself into a corner in the hospital and I poured out my heart in prayer. Philippians chapter 4 verse 6 says, be careful for nothing, be anxious about nothing, but in everything by prayer and supplication with thanksgiving, let your requests be made known unto God. He says, and the peace of God that passes all understanding will guard your heart and your mind. So what happened to me? I poured out my heart in prayer and prayed and prayed and prayed until peace flooded my heart. And God did a miracle at that point. I mean, I will have been grateful enough if, our baby came through cesarean section. And I don't care how the baby comes. He let the baby come. Let's hear the voice of the mother. Let's hear the voice of the baby. That is what matters. But God went beyond that and miraculously allowed my wife, even when the doctors had given up, to be able to give birth safely. But I had to come to that place where I took the pressure off. It was like I took the pressure off myself and I put it on God. 1 Peter chapter 5 verse 7 says, casting your cares upon him, for he cares for you. The way a fisherman casts his net is by throwing it completely out of the boat, except holding onto the rope. He throws it out into the ocean. Take that care, offload it, and put it into the hand of your God, and your prayer will help. By the way, thank you very much for your beautiful congratulatory messages. I really feel honored and feel excited. So revive hope and pray. The third thing I want to encourage you to do is learn to praise God and rejoice in him. One of my favorite scriptures related to mental health is Isaiah chapter 61 verse 3. It says, to appoint to them that mourn in Zion beauty for ashes, the oil of joy for mourning, and the garment of praise for the spirit of heaviness. I believe that spirit of heaviness talked about there is the spirit of depression. When your spirit is weighed down, when you are depressed, when you are sad, when you are hurt, when you are grieving, it says that there are some two provisions there. There's the oil of joy for mourning, and then there is the garment of praise for the spirit of heaviness. Garment in the Bible is symbolic of the Spirit of God upon you, and an anointing of praise. It dispels away the spirit of heaviness. Surround yourself with songs of praise and sing them also. Sing and sing and sing songs of praise unto God, and your spirit will be refreshed. You remember Saul, the king? The Bible will tell us from 1 Samuel 16, where we see a story, how that, the Spirit of God departed from him, and there is this evil spirit that will come to torment him. And then they found David for him. When David would play music, then that evil spirit will depart from him and his soul will be refreshed. There is something about good, godly music that dispels the heaviness of spirit, the spirit of heaviness, and that refreshes the soul. Songs of praise, good music, solid music, with positive lyrics, words of hope, words of faith, words of praise unto God. When you allow such music, it brings refreshing into your soul. And the other part of it is the oil of joy. Now, oil again is symbolic of the anointing of joy, but you have a part to play. Your part is Philippians 4 verse 4. Rejoice in the Lord always. And again, I say rejoice. You consciously choose joy. You consciously decide to practice happiness. And as you practice it, then the grace of God takes over. I was watching on CNN some years ago, and they mentioned how that the brain does not understand too much the difference between real laughter and fake laughter. But when we start laughing, the positive enzymes that are secreted, there are some enzymes that are secreted in the brain when you are laughing, very good ones, that they say goes into the body, relaxes the muscles, strengthens the immune system. That lines up with Proverbs 17 verse 22, which is a merry heart does good like medicine, but a broken spirit dries up the bones. Meaning that when we are happy, it nurtures our health. But when we allow our hearts to be broken and we are sad and we are grieving, it knocks the life out of us. So you want to make sure you practice happiness. Laugh. Even the times when I'm not in the mood to laugh, I get some godly, clean comedy to watch so that I can laugh. And I will watch them and laugh and make myself happy, especially in times when I'm alone. Instead of allowing myself to feel lonely and sad and down, I get myself out of that pit into a better mood. Or if I know somebody that if I call up the person and talk to the person is going to cheer me up. I'll reach out to them on the phone and call them and talk to them and take myself out of the immediate atmosphere and environment of my despair into a happier place. If I do everything in my power and yet it is not enough, I'm smart enough to reach out to a therapist. I'm smart enough to reach out to a psychiatrist if I have to. By all and every means, get help. Don't die alone. Don't die in your despair. Don't die in anxiety. Don't die in your challenges. There are times when some of these things are due to the depletions of certain chemicals in the brain. And certain medical attention will just have to supply them. It is a very smart thing to reach out for help whenever you need it. There is nothing to be ashamed about. We are all human. The man is a tripartite being, spirit, soul, and body. And because we are tripartite beings, we will always need help on those three dimensions. God renews our spirits. Yes, he can help with our souls and our bodies, but he has also made provisions for us by giving human beings the knowledge and the expertise to be able to help concerning the mental and physical dimensions of our existence. 3 John verse 2 says, Beloved, I wish above all things that you may prosper and be in health, even as your soul prospers. The prosperity, your financial and physical prosperity of your health are dependent on the prosperity of your soul. Your mental wellness, your mental wholeness and well-being has a lot to do with your general prosperity in life. Your financial and physical prosperity is proportionate to your mental and emotional well-being. May God bless you real good. I pray that the hand of God will come upon you today. And may the love of God cut through the deepest recesses of your heart and your soul. May all spirit of heaviness, all depression be broken over your life. May there be light shining through every darkness. May there be sunshine after every rain. May the Lord bless you richly and make the rest of your days even like the Garden of Eden. God bless you in Jesus' name. Amen. Thank you very much, Dr. Adeola.
Thank you so much, Dad. Thank you for giving us that powerful, I think, let me see if he, okay. So our anchor is back on. Can you hear, can you, oh, we can't hear you yet. Oh my goodness. I don't know what's been happening to that. Anyways, I'm so sorry.
I'm really listening that beautiful voice.
Oh yeah, same here. Same here. So thank you so much, Dad. I think I would ask for questions now. If you have any questions that you'd like to ask him about spirituality and mental health, he has shared his own experience as well. And I'm sure that it's clear to us that now that even as spiritual persons, we can also seek help when we need it, because we are tripartite beings. We have spirit, soul, and body. So being a spiritual person doesn't stop us from getting help if we need it mentally. So if we have questions, just waiting to see if we have questions. Yep. Someone said, I think I'm allowed to call him Dad. So yes, you can. Feel free to call him Dad.
You're most welcome.
Yes,
you're most adopted into the family.
Yes, you are. You are. Oh, Emmanuel says I have been blessed. Fantastic. It was a very interactive and highly informative session, Dad. I'm glad that people can also watch again. They can also watch the replay on our YouTube channel to go back to it. If they need to, those points that you shared to us, they can revisit it and practice it, because it's important for us to always practice. Knowledge is not useful to us if we can apply it. So we need to apply those points that Dad raised. Yeah, let me see if there's any question. Don't die in silence. Yep. Yeah, that's true. Fantastic. Thank you very much, Dad. I think I'll let you go now. I can't see any questions from anyone yet, but I believe we all know that Dad is on Instagram and is very, very active on Instagram. Dad is a grandpa, but I think he's very, very active on Instagram, on the social media. So you can always reach out to him if you have any question. I'm sure he would be happy to answer you. Dad, am I right?
Oh yes, I'm always checking my DMs on Instagram and on Facebook, and I try my best to reply everybody. Sending the questions.
Yeah. Okay. Please, how can we locate therapists around us? We'll answer that question, Betty. Okay. So we can just put Dad's IG page on the comment box so that people can connect with Dad on the social media. Okay, someone is asking a question. Yeah.
So I have been going through panic attack. A few weeks ago, I had a very bad experience in church where an elder died. I've not been able to go to church since then. Oh, I'm so sorry about that. Apparently, now this is what you've got to understand. The church did not kill the elder. In order to help you with this, I want you to understand that you need to be able to discern issues and separate them very, very well. The elder must have had underlying medical conditions. So everything came to a head when he was in church. If he was at home at the same time, it would have happened. If he was at work at that time, it will have happened. So that it happened in church did not mean the church caused it. Okay?
Yeah.
So you need to understand that it was unfortunate that the person had that, negative experience in church, and probably, who knows, maybe if somebody knew how to administer CPR, and if there was very quick first aid, his life could have been preserved, but unfortunately that did not happen. We hear about people having these experiences again and again. Even today I heard about, a particular in-law who passed away, and it was at work that it happened. So that the person held his chest, it was apparently a cardiac arrest, and passed. So it did not happen because of church. It happened in church, but it did not happen because of church. And I'm sure most likely ever since you've been born, that's the first time that will happen in church. So because of that, and the best way to overcome it is to go to that church. One of the ways you deal with fear is to do it afraid. That very thing you are afraid to do, you do it afraid. You take the word of God and declare, I shall not die, but live and declare the works of the living God. I shall not die. You say that again and again, and go to that church. By the time you worship there once, and you see that you did not die, nobody else died there, you will discover that the feelings of fear will leave you gradually. That is my advice. There may be more professional advice from Dr. Adeola.
Thank you so much, Dad. I think that has answered the question, because this is from a spiritual point of view. This is preventing her from going to church. I wouldn't know if this is just because of fear, or because you felt this person shouldn't have died in church. So maybe you're like, this person shouldn't have died in church. Why would God allow that? But whatever the reason might be, you just have to face this fear, like Dad had said, and conquer it. If you need help by a therapist, then you by all means get it. If you think it's a panic attack and it's becoming too serious, it's affecting your ability to function, then you by all means you need to see a therapist that would help you get over it. Okay, Dad. I think more questions are coming now. Okay, let me see what. So
I'm emotional now. I'm a Muslim, but can relate to pastor's message. God bless you, sir. I had HFD and kept struggling because I am resilient. I sought for help despite being a doctor and became closer to God. Oh, that's so wonderful.
HFD is high functioning depression. High functioning depression. Yeah.
Wow.
Yeah.
Thank you very much for sharing your story, Tope. This is a medical doctor who sought help, and even in seeking for help, she became closer to God. And one of the things you discover is when you get closer to God, you become more at peace. Job 22 verse 19 says, acquaint yourself now with him and be at peace. There's something about acquainting ourselves with God, getting closer to God, that just brings more peace to us. So thank you so much, Dr. for sharing this with us.
Okay, sorry.
How can I educate my mom that mental illness is not a spiritual problem? She prefers prayers to antidepressants. Of course, I understand that our parents can be more religious than we are and more spiritual than we are. I think one of the best ways to illustrate is to use that of physical illness and to say, Mommy, do you know if you have malaria fever, you pray about it, but you also use drugs to cure the malaria? That, we can pray about everything, but we can also get medical solutions. Just like, if you have headache, the paracetamol, Panadol, or Tylenol, whatever we use, as an analgesic, can help to relieve pain. So also can the doctors help to relieve problems of mental illness. So one of the things you don't want to do is to try to put down her spirituality or the importance of prayers. Just let her know that the prayers are helpful, but also helpful is that she gets professional help. So that way it might make more sense to her. Thank you. I recently lost my mom, and it was so hard for me. It affected me then, but I'm in a better place now. Well, thank you so much, Healthy for Life Steps, for sharing your story with us. The loss of a mother is one of the deepest pains any human being can experience in this life. Mothers are golden. They are very, very special to us. And as old as I am, I still dread the day I will lose my mother. Even the loss of my father is something that I know is imminent, because he's an 87-year-old man, and yet I don't wake up any morning wishing I will hear that he's gone any particular day. I don't think that day will ever come when I'll be looking forward to hearing that he's gone. But I'm even more attached to my mother, because mothers are just there. They're much more there for us. And so it's a very painful, and I'm so sorry for your loss. It's just one of those inevitabilities in life. As the arrival of new life in every family brings so much joy, the exit of every life brings so much pain. But one of the things you want to do is every time you feel the pain, don't deny it. If you feel like crying, cry, but again, remind yourself that a reunion is inevitable. Like I said earlier, we are tripartite beings, spirit, soul, and body. It's the body that dies. The spirit and the soul never die. At the end of the life of each family member, reunion takes place again in the afterlife. So let that confidence in that faith in God and of your eventual reunion comfort your soul each time that you remember. And just remember, it's inevitable. This is what happens to every human being who has a mom. And just let your heart be filled with gratitude that you had that for as long as you did. And remind yourself, we will reunite again someday. And the Lord will continue to strengthen you and help you. Over time, it will get less and less painful. The pain will be reducing day after day. So keep hope alive and keep handling each day as they come. It will keep getting better.
Thank you so much, Dad. Thank you for the advice, and I believe Health for Life Steps would have gotten a lot from that. One last question, Dad.
I lost my mom recently, and I find myself struggling mentally. I feel disappointed, and it's been a struggle trusting God and looking after my mental health. How can I move on from these feelings? Yeah, again, from the last story, I want us to realize that it's an inevitability. Your disappointment might have been due to the fact that you probably prayed to God not to let your mom go yet, as at yet. Everybody's mom will go someday. And you are like, Lord, don't let her go yet. I want you to know that, except if we are not being very honest with ourselves, even as a minister of the gospel, I know very clearly in the Bible that there is nowhere that there is a guarantee that we will be able to understand everything that happens to us in this world. What the Bible tells us in 1 Corinthians 13 is that for now we know in part and we prophesy in part. In other words, we don't understand everything. Deuteronomy 29:29 says, the secret things belong unto the Lord, but the things which are revealed to us and to our children. In other words, even though God is a prayer answering God, and you can't deny that because he has answered many prayers in your life, there may be times when it looks like he has not answered some prayers. Why it is so, you may not be able to unravel on this part of eternity. So just know that God is God. God loves you. He loved your mom. And that when you see Jesus face to face, he will explain to you why. Faith is not only when we get answers in this world. Faith is also trusting God even in disappointment. That's why Job said, though he slay me, even if God kills me, yet will I put my trust in him. In other words, I would still die in faith. I would die believing he is God, even when I am disappointed. So just keep hope alive in God. This God is still a good God. If we don't go to him, to whom are we going to go to? Just come to terms with the fact that I just don't understand. He understands. It's like little children. There are times when our children don't understand why we don't grant some of their requests. It does not even make sense to them. But someday they will mature and understand. And that's the way it is in our spiritual journey. Those things we do not understand in this life, we will understand when we see Jesus face to face. May the Lord comfort your heart, strengthen you, grant you the fortitude to bear the loss.
Amen. Thank you so much, Dad. I think we now have to round this up now so that it's 7 o'clock now. We were meant to end by 7, so we have to close. Sorry, we won't be able to answer more questions, but we've put Dad's IG handle in the comment box, so you can connect with him on his social media handles. Thank you so much for coming. We are really grateful and we appreciate you, Dad. We hope that next time you'll be able to come when we call you again and you give us more information about how to take care of ourselves, both spirit, soul, and our bodies. Yeah.
It will always be my pleasure. Thank you.
Thank you. Have a good evening, Dad.
Thank you.
Yeah, bye.
Bye.
Okay. So I'll be bringing back our MC. Yep. I hope her audio is now good. We're so sorry for this each. I know that we didn't plan it that way, but I believe that we're all blessed. Now I have to round this up because I don't even know how to do this. I'm sorry, I'm not an MC. I've never anchored any events before, but I want us to tell me, what one thing have you learned from this? I mean, from this conference, it's the first of its kind. We believe it's going to get better as we go on. But can you please tell me what's one thing that you are taking out of this conference? Put in the comment box. What's that one thing that you will never forget? Because there's no point coming on and doing a conference like this and nobody gets blessed or life transformed or nothing changes in your life. So tell me one thing that you're going to be changing going forward as you leave this conference today. So I'm waiting. Yeah. So Abilite says, such an atmosphere filled with plethora of information. Well done, Dr. DrAdeolaAdeyemi. Thank you. Not just me, myself and my team have been fantastic. Thank you very much, Abilite. Can we have more of this section, Doctor? It's really impactful. God bless you. Yes, we plan to have more and more of this session. So we look forward to having yearly conference, God willing. You know, this is our first, but we hope to have more of it. Yeah. Charles says, being intentional about my lifestyle. Fantastic. Stella Marie says, trusting God even in disappointment. Absolutely. Chibuike say, how do I deal with inconsistency in the place of prayer as someone with anxiety disorder? Dad has left. I'm sorry, Chibuike. Please connect with Dad on his Instagram page. He's going to be able to answer you. Augusta says, I'm refreshed. Emmanuel says, the holistic approach to mental is what I have learned. Well done, theme. Thank you, Emmanuel. Thank you. Dr. Adeyemi, confidence is a great thing I have learned and to study myself. Thank you so much. Thank you so much, Titilayo Adeyemi. Busola Bamisaye said, do it afraid. Rest and self-care is important. Absolutely. Adeola says, we need to have more of this. Wow. So we need to have more of this. My team and I will keep working and we'll keep creating awareness. I know it's a lot of work, but we won't give up on ourselves, right? We won't give up on ourselves. We'll continue to push this message. And remember what Dr. Abiri had said, that the responsibility is not just for professionals like myself or Dr. Abiri or every member of the team at Talk Mental Health. It is your business as well. Mental health is your business. Everyone that is commenting, Adeola, Busola, Adeyemi, Titilayo, Emmanuel, everyone that attended today, it is your business. So when you leave this place, the first thing I would expect you to do is to tell someone about this conference. Tell them they have missed, but then they can have access to this live and watch the replay on YouTube, go through it for 2 hours, read, and make sure that they apply all that they have learned from the video. All right. So that's something that we need to do ourselves. Tell someone that will tell someone, keep creating awareness, sharing the good news about mental health, spreading the news to everyone that it's okay to have mental illness. And we need to all be intentional about our mental health. Right. So someone has said, seek for help when you need it and not to stigmatize people with mental illness. I suppose that's what you want to say, Tokweji Moya. So don't stigmatize people with mental illness. Fine. Continue to be an advocate. David Hastrops is continue to be an advocate. I'm blessed to be here. I learned a lot. Fantastic. So as we round off now, Healthy for Life Steph says, I joined this conference not really knowing what to expect, but because I work in a social care field, I've given me a great insight on how to counsel people I come in contact with. Thank you, A. Well, thank you very much, Healthy for Life. I believe that's Maria. Thank you so much for joining. All right. So as we round up, I just want us to know that Talk Mental and Emotional Health is a foundation. We offer free counseling sessions. All right. We understand that it is very, very difficult for people to seek help. No, to seek help, yes, number one, to even access treatment because of how expensive this could be. And we thought that giving free counseling sessions to people can help them, at least to an extent. We may not be able to offer free therapy for all the therapy sessions, but we offer free counseling sessions through our amazing volunteers at Talk Mental Health. So this is the link. We're going to put the link in the comment box. Just click the link and book your free counseling sessions. Do not bottle your feelings. Speak up, all right? And also, if you would like to, if you want mental health assessment, you want to take your therapy further, you need a therapist. Like someone has been asking, how can they access therapy? How do we get someone a therapist? So myself, I offer therapy session. You can see it on the screen right now if you want that. Dr. Abiri, that spoke earlier, also offers therapy sessions. So you can go to our page, go to our website and get the help you need. Remember, it is your responsibility to take care of yourself. Don't leave your mental health to chance. Don't wait till you break down before you take care of your mental health. Get help immediately. All right. Yeah, fantastic. So that will be all for today. I don't know if we have any other question. If not, we're going to end. And my closing, at first, I want to say thank you to everyone. Let me say thank you to every one of you, everyone that showed up early. I want to say thank you for coming. I thank you so much. I'm really grateful. And thank you for making this interactive. That's one. Number two, to all our speakers, Dr. Abiri and Reverend Victor Adeyemi, thank you for coming. And thank you for giving us that knowledge from your wealth of experience. And to all those people that are working behind the scenes, this conference wouldn't have been a success if I didn't have people that supported me. I mean, I want to say thank you to DrAdeolaAdeyemi. I want to say thank you to Mary. I want to say thank you to Mercy and all the volunteers. I also want to appreciate my husband. His name is Mike Adeyemi, and he has been supportive of me. I wouldn't be where I am today or being able to come out to do all of this if I didn't get the support of my husband. So thank you so much. I know he's watching. I love you and I appreciate you. I think that's all for now. I think we have another book. We have free resources at Talk Mental Health. Please, we have 21 days audacious affirmation. You can get it for free. Yeah, that's all. Thank you, everyone. I don't even know what to say anymore. Thank you so much. Oh, thank you. Thank you very much. I think that will be the end of the conference, Mental Health for All. Bye.